I'm Dr. Ninh Tran. I'm the Medical Officer of Health for Southwestern Public Health. The regional measles outbreak continues to be a concern here, with 12 confirmed cases of measles reported to our health unit since January 1st, 2025. I really want to thank our local media as well as our local healthcare partners for helping us amplify the message to call ahead to healthcare settings when one has been exposed to and or has symptoms of the measles. This has been really important and critical in managing exposures and preventing further exposures. I do want to note that the first line of defense against measles is to make sure you and your loved ones are up to date with your immunizations. So let's talk about what that means. So first, it's important to understand and check your immunization history. That means looking for your vaccine records that you might have in your house, or looking at your local public health unit's website, or at times needing to consult or ask your primary care provider. In general, adults that are born before 1970 are considered protected against measles, so no boosters are needed. The only exceptions are if you work in healthcare or you're members of the military, and there's a general expectation you also need 2 doses, even if you were born before 1970. So for those who were born in or after 1970, 2 doses of measles-containing vaccine provides up to 99% lifelong protection. So it's great that we have something that is so effective that we can use. Typically, children receive their first dose at the age of 1 and a second dose between the ages of 4 and 6. So if your child is already 4, don't delay the second dose. Go get that as early as you can once your child turns 4. Also, because we're in an outbreak situation, we're also asking parents to look at protecting their infants earlier. And parents we're encouraging our local parents to talk to their healthcare provider about getting a first dose of measles-containing vaccine between the ages of 6 and 11 months. Your child will still need 2 additional doses of measles-containing vaccine after the age of 1, but this earlier dose can help infants be greater protected against the health impacts of a measles infection. This is particularly important if you live, play, travel to, or worship in an area with known measles risks, which is why we're encouraging those living, playing, and traveling to our jurisdiction to consider this option as well. And to anyone listening or watching who have previously hesitated about getting vaccinated, it's not too late to change your mind and get yourself and or your child immunized. Talk to your healthcare provider or public health for assistance. So while our health unit, as well as Grand Erie, respond to measles outbreak locally and regionally, cases are rising across the province and Canada as a whole. Everyone has a window now to protect themselves and their family from a preventable illness. And we do note that measles can carry serious complications, whether that's pneumonia, hospitalizations, and even brain infections. So thank you so much for listening. I'll hand it back to Natalie as a moderator.
Thanks, Dr. Locke. Thank you, Dr. Tran. Now over to Dr. Locke for an update from Grand Erie Public Health.
Yes, good morning, everyone. Thanks for joining. And right now in Grand Erie Public Health, our current status is that as of today, we have 37 confirmed cases of measles, and of those 37 cases, 5 are adults and 32 are children. So predominantly children are being affected here. And as far as what we are doing in Grand Erie Public Health, the team is continuing to monitor and manage ongoing changes in the measles situation. And as Dr. Tran has already said, we encourage community members to visit our Brant County or Haldimand-Norfolk County website for full exposure information and locations so that you can see where these are occurring and whether you're in that area. As we continue to investigate various measles cases, we're also continuing to contact tracing, and those areas that are affected are being contacted by our infectious disease team. The vaccine eligibility changes that Dr. Tran has already mentioned are in effect, and the recommendation once more are 2 doses of measles vaccine in people that are born in 1970 or onwards and who play, travel, or worship otherwise in Southwestern Public Health and Grand Erie Public Health regions. An early dose of 6 months, 6 to 11 months is recommended now, and early doses for children under 4 years, as Dr. Tran has mentioned. So what should you do as a community member? First of all, as Dr. Tran has already mentioned, you need to specifically check your immunization status, watch for any symptoms of measles, which are published on our website. And if anyone is experiencing symptoms, as Dr. Tran has already said, it's extremely important to call ahead before attending any health care facility, mainly because, as we've said before, this is a very infectious disease, and contact and exposures are very easily maintained for up to 2 hours in a room following a visit. So it's important for your healthcare provider to manage cases as they come in and to isolate people if there's any consideration that they may have contracted measles. We've already stated, I think Dr. Tran has stolen the limelight with regards to who should get the measles vaccine. But if you're unaware of what you need to do, please visit the Haldimand-Norfolk or Grand Erie Public Health websites. All the information that you need is there, and the immunization recommendations are also contained on the website. So that's our situation. We're still experiencing new cases, and most of the cases, our cases, are situated in the Haldimand-Norfolk area, an area which is known to be underserviced with regards to vaccination coverage. So that's my update from here, and thank you.